Hi class, today I would like to discuss my graphic for my evidence-based change in clinical practice, which involves an RN-led transitional care program for congestive heart failure patients with the aim of reducing 30-day readmissions for heart failure, which you can see here at the core of my graphic. In this outer circle of my graphic, which includes 6 smaller circles, which are the interventions involved in my clinical practice change. These interventions happen in sequential order throughout a patient's hospital stay, and they all only occur once, except for education and interdisciplinary rounds, which should occur on a daily basis while a patient is admitted for a diagnosis of congestive heart failure. The first intervention involves the nurse's initial assessment. This will be done for any patient admitted to the floor with a primary diagnosis of congestive heart failure. Ideally, this nurse's initial assessment will be integrated into the admission flow sheet in Epic so that nurses don't have to take that extra step, and it ensures that the assessment actually gets done. In this assessment, the nurse will help identify the caregiver and any backup caregivers for the patient, elicit their goals for the hospital stay and surrounding congestive heart failure, and then inform the patient and family, whoever is present at the time, of the steps that will be taken for discharge. The second intervention includes education. This used to be done by the floor nurse assigned to that patient, but this evidence-based change in clinical practice will involve creating a new role, which will be a CHF RN educator who will provide patient-centered education to both the patient and families. They will go to the bedside daily and perform an assessment of the patient's congestive heart failure, and then educate them on key topics pertaining to congestive heart failure. The bedside nurse will also provide education, but more in terms of reinforcement and the medication that they're administering to the patient. Both, however, will use the teach back method in order to assess learning and learning needs. And the CHF RN educator has a teach back tool that they can use and either administer to the patient if they have the ability to write and or perform orally to the patient if they have any sorts of impairments. They can also use a tablet at the bedside to help assist with their education. This will occur daily while the patient is in the hospital, and the RN-CHF educator encourages caregivers and families to be there whenever possible. So if necessary, they can schedule an education session with the family that day or the day before to ensure that everybody is there getting the education that's going to be necessary for a safe discharge. Also, an intervention that will occur daily are interdisciplinary rounds, when all members of the interdisciplinary team collaborate at a set time each day. They'll discuss any concerns or the progress of the patient and identify any patient needs. Though the provider and team will discuss orders in real time and verbalize them, this will also allow for them to put them in real time to prevent any delay in care. At the conclusion of these rounds, the provider and the bedside nurse will go into the patient's room, ideally the family being there as well, and update the patient and family on the plan of care and the steps towards discharge. If the family isn't there, then bedside nurse can always call the family to give them an update, or when the family calls in for that day, the nurse can provide the update then. These interdisciplinary rounds are essential because they incorporate, like I said, all disciplines. So really making sure that all aspects of the patient's care are being touched upon and everybody's looking at the patient from a holistic point of view, and that they're adequate and ready for discharge, or making those steps towards discharge that are necessary so that the patient can have a safe discharge home and be successful at home. During these interdisciplinary rounds, 1 to 2 days prior to discharge, the team will decide that the patient is getting close to discharge, and they will decide to schedule a discharge meeting with the patient. So this discharge meeting will be yet a new intervention that is involved in the clinical practice change I'm looking to implement. And it involves the presence of this interdisciplinary team, the caregiver, and the family, all being present at once, 1 to 2 days prior to discharge. Here, the team can go over the patient's discharge plan and address any questions or concerns the patient and family has. At the time of scheduling of the discharge meeting, the nurse will administer the Be Prepared to Go Home booklet and checklist, which they can read through, the family can read through, or the bedside nurse or RN/CHF educator can go through with them. And they can assess their own learning needs or their comfort level with where they're at and their readiness for discharge. And it can also help elicit questions and concerns that they can write down in the designated area that the booklet actually provides for notes, so that they can remember to bring them up at this discharge planning meeting. Again, the teach back method will be used here to educate as well as reinforce any education or any topics that arise during this meeting. And at this time, too, the provider or any of the members of the interdisciplinary team can make recommendations, offer to schedule follow-up appointments, referrals, and social work will be there to discuss any home care needs. 1 to 2 days later, we'll reach the next intervention, which will be discharge, the actual discharge, when the nurse, and here the nurse will be with the patient and the family member and discuss the discharge instructions on the after visit summary, medication list, and follow-up appointments with the patient and family. Again, they'll address any questions and concerns the patient has utilizing the teach back method. Then lastly, the last intervention in my evidence-based change in clinical practice will be a discharge phone call, which will be performed by the RN/CHF educator. This will be, again, part of their new role. And they will provide follow-up phone calls 1 to 3 days after discharge, and the patient will be informed that this is happening during discharge. It will be on their AVS that they should be expecting a call within 1 to 3 days. And they'll utilize a phone call script to help target the conversation so that they can address any issues, any problems that might be arising if something, or might have arisen if something sounds off. They can talk with the patient, problem solve, and either help the patient fix the problem at home and or make the recommendation that they need to go see their primary care provider or go back to the emergency room. During this time, they can also provide any education that the patient might need reinforcement on from the conversation. And this discharge phone call has been proven to help patients succeed and transition home more smoothly by addressing any issues that might come up those 1 to 2 days after discharge that can really set patient back. So all of these 6 interventions together are what my evidence-based program is built of, or is composed of, to help reduce 30-day readmissions for patients with congestive heart failure.